Cannulation is a fundamental clinical skill performed frequently, and choosing the right insertion site is crucial. In this demonstration, a 20-gauge pink safety cannula is being inserted into the cephalic vein near the wrist. The site is thoroughly cleaned with an alcohol swab before insertion. The cannula is held between the thumb and middle finger, with the index finger used for stability and control. The needle is inserted at an initial angle of about 30 to 40 degrees. Once the skin is penetrated, the angle is reduced to around 10 to 20 degrees to advance further. The cannula is then guided smoothly over the needle using the index finger, while the needle itself remains still. The cannula is advanced fully before activating the spring-loaded safety mechanism, which retracts the needle. The built-in valve in the safety cannula prevents blood spillage. If no valve is present, pressure should be applied at the distal end of the cannula before attaching the reflux valve. Afterward, a dressing is applied to secure the cannula. Techniques may vary among senior clinicians, but most are acceptable within clinical practice. If blood samples are required, it is best to collect them directly from a cannula hub rather than reflux valve caps, as the latter increases the risk of hemolysis. The cannula is then flushed with normal saline. In this demonstration, the clinician applies the dressing strip close to the insertion site without covering the puncture point. This allows clear visibility of the insertion site through the dressing window, ensuring early detection of displacement or dislodgement.